Hello, everybody. This is Dr. Gregg Hanzlicek from the Kansas State Veterinary Diagnostic Laboratory and the College of Veterinary Medicine at Kansas State University, and continuing with our series of videos discussing how to use antibody titers when we've got some type of fetal attrition that has occurred in our cow-calf operations. And the use of this, we're talking about those animals, those cows or heifers that were preg checked second, third trimester, and now it's calving season, and they are open. They've been confirmed open. We don't have the gold standard fetus or fetal tissues and placenta to submit, and so from that standpoint, we're going to use antibody titers to at least try to rule in or rule out IBR, BVD1 and 2, and lepto. So let's just go through a couple cases real quick, show you how we do this. Case number one, 210 cows were preg checked. They were early third trimester. 8 were found open during the calving season. They weren't springing. Veterinarian went out there and palpated them and confirmed that they were indeed open. This herd was vaccinated about 10 months ago with a modified live vaccine. So again, at the top, these are our concern levels. So when IBR and BVD1 and 2 get to these levels or higher, then we're going to start thinking that perhaps these titers do not represent normal background, that they could represent field exposure. Lepto, it's going to have to be above 800 before we're going to start thinking that it's probably not background, but it's field exposure to the lepto serovars. So here's the samples, 5 samples, and again, we can do some analysis on one sample, but because we're going to be looking for patterns within pathogens across animals, 3 would be the minimum sample that makes it easy or makes it more important. But 5 samples are perfect. You can submit more, that's fine, but five will allow us to see if there's any patterns within each one of these pathogens. So we'll go through here, look for IBR. We're looking for 128 or higher. We don't see anything there. So we can say we feel comfortable saying IBR probably had nothing to do with the fetal attrition. BVD1 and 2, we're going to be looking for 1,024. We've got that. We see one with 1,024, and then lepto, we need above 800, so essentially 1,600. Don't see anything here. So we've got one animal that has a BVD1 titer that's at our concern level. And so our interpretation is that this is probably just biological variation. She just has a higher antibody level for that particular pathogen than the other ones in the herd. And so this is a pretty easy one. Looking at those values that came back, we would just say, you know what, these are normal background titer levels, and there's really probably no reason to consider any of those pathogens to be contributing to whatever happened to in the fetal loss issue. Case number 2, 92 cows were pregnant third trimester, and now 12 were found open, and they were vaccinated 8 months ago with a 6-way killed vaccine. So again, our concern levels at the top are 5 animals that were sampled. We just go through each one of these. We're looking for 128 or higher in IBR. We've got 1, 2, 3, 4. So we've got 4 out of 5. So that's on our radar. BVD1 and 2, we're looking for 1,024. We got 1 here. And then lepto, we're looking for basically 1,600. And we've got 1 here. So these are our elevated samples. So 4 out of the 5 is certainly a concern. We've got these 2, but if we look across here, these 2 elevated serum samples titers are from the same animal. She's also high in IBR. Is she contributing to 4 out of the 5? Is she skewing our data? Maybe, but even if there was 3 out of the 5, we'd still be we would be concerned. And so we would just consider her to have a good immune system for several of the pathogens or several of the things that we vaccinate for. So our interpretation here is that 4 out of the 5 IBR titers are above the concern. Yes, we did have 1 BVD and 1 lepto. but that's one cow. She was responsible for those. And so our term for her is a super responder. She just has a really good immune system. She's a cow that if we could, we probably would like to at least clone her immune system so that everybody could have that kind of response. So our interpretation of this is that IBR would have to be considered as a possible explanation for fetal attrition, and then the veterinarian would do what the veterinarians know how to do is then take the next steps to at least prevent an IBR issue in the subsequent years in this particular cow-calf herd. So stay tuned for more case samples. We've got many more, or at least several more that we'll share with you through time. We're going to plant those on our YouTube channel. Again, if you just use your phone, and the QR code will take you straight to our channel. And we highly recommend you subscribe to our channel. That way, every time we put a new video on, it'll ping you and it'll let you know that we've got something new on the channel to share with you. So really appreciate the opportunity to be with you today and talk about this. This is pretty cool stuff. So stay tuned. Thank you very much.